Hi, I'm Danny Michael, certified financial planner, and welcome to another live webinar here, streaming onto Facebook and YouTube channels. And today we're going to cover retiring before age 55. This has become an increasingly more popular topic. Been talking to a lot more clients recently. When I say recently, like the last 2 to 3 years, due to COVID, the big retirement surge that we've seen, primarily from mostly the baby boomer generation. If you have any comments or questions during the webinar, feel free to pop them in the comment section. I'll be happy to address those as we move along here. But today we're going to focus on trying to find the best affordable insurance options before age this is 55, should be before age 65 actually. So before age 65, the insurance gets pretty expensive, right? Because Medicare starts at age 65. Before then, you really have to address things on your own and try to afford your own private health insurance. So um, why does this matter? Again, I've kind of mentioned, COVID, more than 3 million Americans retired early because of the COVID crisis. So just a lot more folks doing that. And this is a big expense, right? You can see here that for seniors age 60, the average cost of health insurance on the marketplace is over $1,000 a month, right? So that's not chump change. If you're a married couple planning to retire early, that's a large monthly expense that you have to fund on your own. So a cheaper low coverage plan, which is not going to give you the coverage that maybe you need, is going to be about half that cost. So still a significant amount. And by comparison, the Medicare Part B premium is only $164 a month, right, in 2023, if you're not subject to IRMA. So for anyone that's planning to retire before age 65, you have to look at this as a consideration, and take a look at all your different options to determine what's the best way to fund that. So that's what we're going to talk about today. And the first thing we're going to talk about are going to be workplace insurance policies. So, this is essentially, work offered by your employer. And it's obviously if you retired, you may not have insurance anymore, but your spouse could still be working. So you always want to make sure that if this is a plan and one spouse is maybe planning to work a little bit longer than the other, there's typically an age gap between spouses. It could be anywhere, from 4 years or 5 years, or more than that or less than that. But whatever that gap is, if one spouse is still working, you can plan on joining that retirement plan. So you want to take a look at that plan, when's eligibility to add another participant to the plan, and then also what's the cost going to look like. So something you should evaluate there. Another option that's not talked about a lot is looking for a part-time job post-retirement. So there are some businesses, some employers that will offer insurance even as a part-time employee. They're typically going to be larger companies. But if this is something that is maybe a sticking point that's preventing you from retiring, and it's just this insurance cost, and you still want to work, you may want to try to look for an employer that's going to offer you that kind of benefit, some health insurance benefits. And then maybe you're working part-time. And this is a little bit, I guess, of the new retirement. The new retirement today versus, your parents' retirement is that folks are typically staying pretty much a lot more active in retirement these days. They're doing volunteer work. They're, starting, any type of passion project, starting a YouTube channel. I mean, there's so many things you can do this day and age. So, just kind of retiring and sitting at home and watching TV is kind of the old retirement. That's not really happening as commonly anymore. So, you could find a job, something that you like to do. Maybe you have consulting background, or a special skill set from your previous career. You can use those skills as in a consulting gig or something of that nature as well. Or you can find a job with someone that's going to value that expertise and but doesn't need you full time. So a lot of different options there, and something to certainly look into. Some companies offer retiree benefits, including health insurance. So 21% of large companies that offer health benefits also offer like retiree health plans as well, for some employees. And some employers may even pay for some of that monthly. So, there's just because you're retired and you don't have a full-time job doesn't mean that, you can't get benefits from an employer or doing some sort of part-time work. Um, Another very, very popular option, although not the most affordable, is going to be Cobra. Cobra is usually going to be like a couple percent more than your than premiums you're paying in your previous plan. You can see that Cobra covers group health plans sponsored by an employer, private sector, state, local government that employed at least 20 employees or more than 50% of its typical on more than 50% of its typical business days in the previous calendar year. So this is a lot of businesses, right, are going to offer Cobra, unless you work for a really kind of like a small mom and pop type of employer. To be eligible for Cobra, you must have been enrolled in your employer's health plan when you worked, and the health plan must continue to be in effect for active employees. So as long as your previous employer still has a health plan and you were participating in that health plan, then you'll be eligible for Cobra. And your employer must notify you of your Cobra rights. So when you do leave work, you're eligible. If you're eligible for Cobra, you can typically continue your health coverage for up to 18 or 36 months after you stop working. And even if you don't sign up for Cobra for yourself, you can have covered family members that may be eligible for continuation of benefits. So again, going back to, let's say you're a married couple, you decide to retire together. You may be eligible for your spouse's Cobra if your employer didn't have Cobra. So that's certainly something that you want to make sure and cover. Really, and this is kind of the primary place for you to get the most affordable insurance is going to be the Affordable Care Act marketplace. And essentially, if your income is at certain levels, you can also qualify for premium tax credit. So let's kind of talk about this a little bit more. This marketplace is kind of your best bet for temporary affordable coverage, especially if you have several years, until you turn age 65 and are eligible for Medicare. It's typically going to be cheaper than the private insurance marketplace. All ACA plans must provide 10 essential health benefits. So they're going to be pretty comprehensive in nature, which is good. Obviously when you're older, you want to make sure you do have good comprehensive coverage for health insurance. And then for seniors age 60, like the average cost of health insurance on the marketplace is $1,025 per month. Cheaper low coverage plan to start around $500 a month. So still, it's going to be expensive, right? But it's going to be cheaper than getting private insurance. And then depending on your income, again, you could qualify for the premium tax credit. Okay, premium tax credit is essentially it's a measure of your income. And it's essentially looking at the poverty line. So if the poverty level, you can Google, federal poverty level income. It'll tell you the levels for 1-person household, 2-person household, 3-person household. If depending on your household size, if you're 100% to 400% of that number, your income is in that number, you can qualify for tax credits, essentially reducing the premiums that you're going to be paying for health insurance. And so why this is a very popular option for a lot of folks is if you do retire early, well, then your employment income is gone. If your only other income is essentially could be maybe from like real estate, like rental income. Again, you could have some spousal income, but let's say both spouses retired, you don't have any more employment income. There's not a lot of other sources of income you're going to have that are going to increase your tax bracket. And so depending on how you're generating income, so whether you're taking distributions from, like, let's say Roth IRAs or maybe taxable accounts, because those don't actually show up as income on your tax return, right? You already paid distributions from a Roth IRA or 100% tax-free in a taxable account. You can have positions that don't have large amounts of gains, right? And then so you don't have a lot of reportable income. In that scenario, it could make sense to kind of, live off that money, keep your income lower while you qualify for these affordable tax for these tax credits to make your health insurance more affordable. And again, it really just depends on your situation, all your other, areas of your financial situation. And, so what are your potential sources of income? What are your resources? Okay, well, what's the best way to create that income? But this is certainly a consideration that you could qualify for premium tax credits, making your health insurance a lot cheaper. Outside of these options, so again, I'll kind of go back, right? We talked about Affordable Care Act. We talked about Cobra. We talked about workplace insurance. So your spouse, or you can get a part-time job, or there's some large companies that still might offer, right, health insurance plans. Outside of that, you could get what are called short-term insurance plans They're typically for like 1 year. They're like stopgap plans, but they're not comprehensive in nature. So you could look into that. If you just Google short-term health insurance, you can find some different options out there. Not the best, again, not the best place to go. And then outside of that, it's just again the private insurance place, and the private insurance marketplace is going to be expensive. And so you want to look at these options first. And if that doesn't, if none of these options work for you, then you're kind of forced to looking at the private insurance marketplace. And so the one of the most important things, and there's an article on our blog. It's called Retiring at 55. That talks about a lot of the considerations that you should be making. So if you go to satoriwealth.com, just click on the blog tab. You could read a blog there and just search for, just say age 55. There's a blog in there that talks a lot about all the other considerations. There's a ton of considerations to make if you want to retire early. And one of those is, example, you can't take money out of your retirement accounts. There's limited amounts you can withdraw from things like your Roth and your IRA. So you really got to do some planning ahead there. But certainly a lot of considerations, and this is one of them. Getting insurance before Medicare kicks in. So hope this was informative for you. If you have any questions, feel free to post in the comment section. We'll be happy to answer any questions for you. And aside from that, keep living your best life in retirement.